Hello, my name is Lilia Bella. Today is March 15, 2015. My topic is thyroid, and my introduction will be is that thyroid is it controls the metabolism in the body. It makes the organs work properly. My slideshow, I state that thyroid glands is shaped like a butterfly. The thyroid balance, the thyroid gland makes and stores hormones. Hormones help regulate the heart rate, blood pressure, body temperature, and metabolism. So you can tell a lot of people that have thyroid problems. They have gained a lot of weight, and some people lose a lot of weight. Also, too, their blood pressures are, some people's blood pressure might be very high, some blood pressures people's might be very low, and they're not able to control body temperature. You might be cold one minute and you might be very hot the next minute. The thyroid gland is shaped like a butterfly, which two lobes attached is located in the front of the neck. So sometimes when you have a sore throat, your thyroid glands might be very swollen just because of the part of the thyroid shaped as a butterfly in front of your throat that causes inflammation. And when you're, also too, when you're sick, it's hard sometimes to swallow, difficult swallowing food. We're going to move on to the next slide, which is the hypothyroidism symptoms and what does it affect. Next is the thyroid nodules that you end up having on the side of your left side of your neck or the right side of your neck. Also, too, what I've noticed with the thyroid nodules is when you're sick, it does hurt. Especially on that side, it might become a little swollen, a little tendered, and especially when it comes at nighttime. Sometimes it's very hard for you to breathe, just because that side is very swollen and it just hurts. I had a needle biopsy done to my thyroid nodules. They took cells from the nodule just to find out if there was any cancer cells. Mine were benign, which is good. What are the signs and symptoms? Swollen neck, it can cause trouble breathing and wheezing, and the voice may become hoarse. Choking on food and a hard time swallowing food. So I did kind of state it at the beginning of my slide that you have sometimes difficulty swallowing food. Sometimes your mouth will become very dry, and then your tongue will be very swollen. And then there's times that your taste buds, when you taste the food, might not taste the same. Forgetting things or trying to remember where you place an item. That is so true. Trying to remember where you put items. Sometimes I end up forgetting where I put things. There's times that I have to go back to that same room just to remember where I placed that item. You end up forgetting special events, or also too, the conversation that you just had with a person, the next thing you don't remember. So that's a couple of things that I can share with you. Constipation, not able to have a normal bowel on a regular basis. Yes, there's times that you're not able to have a bowel, you know. So I encourage a lot of people to eat fiber, more fiber in their diets, and just to try to regulate their bowels, because there's times that where your stomach might be very bloated and you're not able to pass a bowel just because of part of being constipated. On my next slide, my pituitary glands. That is something that I suffer from. I actually was diagnosed with a pituitary tumor in my brain, and that's how I found out that I was having thyroid problems. One of the signs was I couldn't understand why discharge milk was coming out of my breast, and I went to my doctor and she stated, you have a tumor on your brain. Well, that was a very scary thought, knowing that I could possibly have a tumor in my brain. So I ended up doing the procedures of getting the MRI and finding out that I did, and I still do, have a pituitary tumor in my brain. One of the signs they mentioned is floaters on your eyes. There's times that I do see those. And just the part of just like your hormones, you know, not, you know, there's times that where you're very happy, you're very sad, you're very moody, and there's times that you just feel very depressed. I have patients that I've seen with pituitary tumors, and this man just got diagnosed with new onset to diabetes, so that is scary. Just because just finding out that that could affect your pancreas along with your ovaries, your testicles, vision. So that is something that it's a concern. My next slide, I did, you know, mention about the breast discharge that can occur. Eye prescriptions will change and we will see floaters in your eyes. That is true. My eye prescription has changed through every year. My prescription gets a little bit stronger. Decrease in your sexual activities with your partner and feels tired at all times. Yes, you feel tired, feel like you don't have a lot of energy like I used to have. And there's some times where you don't feel like having sex. Yes. Thyroid cancer. I have patients that have come in and they have to actually remove their thyroid due to cancer. And patients have to take thyroid medication for the rest of their lives. And actually, they have to actually take 2 doses of thyroid medication in order for them to keep with the metabolism and have their organs working how they're supposed to be working. Patients lose a lot of weight. They have to go to chemotherapy, radiation, and they have to go through a process of where they remove the thyroid, and you can't speak for a good, I think it's 2 to 3 months, that you cannot talk, hard time swallowing after the procedure, because they're actually cutting your, you know, the middle of your throat, so you're not able to, you know, talk, or difficult swallowing. It is painful, but it eventually, you'll heal. Thyroid cancer. I mentioned thyroid glands become abnormal growth and form lumps in the neck area. The lumps can cause difficult swallowing and make difficult to pass liquids or foods down your throat. Thyroid cancer will cause weight loss and become very fatigued, very tired. It's like all types of cancer. Become very tired. Skin is very dry. No energy. You just, feel like your world is falling apart. My conclusion would be is if you start having signs and symptoms of you losing weight, one of the things would be is to visit your doctor, get tested, get your blood work done, test it to test your thyroid, make sure that your levels they're off. There is some medication that you need to take. Try to maintain yourself healthy, stress-free, exercising, and just living life. A lot of people are in our area, which is we have a lot of people that are affected with thyroid problems. We're starting to see more volume in men also too with thyroid problems. So there is a lot of people that don't believe they have thyroid problems and refuse to take the medication, which we also have kind of mentioned that this can lead to to death because your body is not balanced correctly. They're taking vitamins from each side and your body's just unbalanced. One of the things is that once your organs start shutting down, that means that your body starts shutting down. So it's very important that you follow up with your doctor. You get tested every 3 to 6 months. Ensure that you maintain yourself as healthy as possible, exercising and eating right. And if you continue to have thyroid problems, then the next thing to do is probably consult with your doctor and have them, give you the decision of maybe removing your thyroid and having less issues or less health problems. I think that's all I have for my presentation. Thank you. The references where I searched my information was WebMD. I gather a lot of my information there. It's always accurate. Information is very good information. I also searched my information in the American Thyroid website. They also mention a lot of good information regarding thyroid, and just count, where it's going to be different campaigns where motivator speakers will be there to give information to people that are still uneducated about thyroid problems. Also, too, I search under the thyroid cancer treatment health professional information, which gives information on how to overcome thyroid cancer, and they just patients share their stories so they can educate other patients.